Good day, friends. I am Dr. Sanjay Kalra, your friendly endocrinologist. You're watching Dr. KK's Medtalks, Mondays with Dr. Sanjay Kalra. और आज के हमारे नॉन स्टॉप शो का 533वां 533rd एपिसोड है। विंटर है, ठंड है, पर ठंड के अलावा अब ओमाइक्रॉन भी है। सो लेट्स हैव द हेडलाइंस फॉर टुडे। आज के हमारे गेस्ट हैं एक बहुत स्पेशल गेस्ट जो मालदीव से आए हैं और ये अपने फील्ड में एक्सपर्ट हैं। मगर इनसे बात करने से पहले हम आज की हेडलाइंस देखते हैं। गोवा हैज डिटेक्टेड द फर्स्ट ओमाइक्रॉन केस इन एन 8-year-old, सिर्फ 8 साल के बच्चे में, इन एन 8-year-old रिटर्निंग फ्रॉम द यूनाइटेड किंगडम। New Delhi has started night curfew from today, and there's a yellow alert which is likely because of the increasing COVID-19 cases. Do note that night curfew has been instituted in many states in the country. India has also announced a precautionary COVID-19 dose for the above 60 category. Precautionary dose means कि तीसरी dose लगेगी. There will be a third dose now. And the third dose will be of the same vaccine. The precautionary dose is applicable if you have had your second dose, that means your last dose, at least 9 months ago. तो यदि आप 60 साल से ऊपर हैं, if you are age 60 and above, और आपकी आखिरी जो कोविड की वैक्सीन थी वो 9 महीने पहले लग चुकी, दैट इज इन अप्रैल 2021, तो अब आप एलिजिबल हैं 10 जनवरी से, फ्रॉम 10 जनवरी ऑनवर्ड्स यू आर एलिजिबल फॉर योर प्रिकॉशनरी डोज विच विल बी योर थर्ड डोज. Which dose will you get? The same one which you got earlier this year, whether it is Covaxin or Covishield. So good evening everyone, and let's look at our topic for today. So like we said, it's winter now, and winter के साथ Omicron भी आ गया है. So we need to contain COVID. And how do we learn about COVID containment? Let's learn from the experts. And where are the experts? The experts are all over the world. एक द्वीप है, an island, or rather a group of islands in the Indian Ocean, and that is the Maldives. And while the rest of the world was closed to travel, closed to tourism, Maldives kept itself open. It kept itself open for all of us. How did they manage to do that? Let's ask our guest for today. Let's see who our special guest is. Warm welcome, Dr. Ali. Just to unmute Dr. Ali. Yeah.
Thank you very much, Dr. Sanjay, for inviting me to this program. I really appreciate it. And we have been very wonderful and giving us a lot of chances to the doctors community. Thank you so much.
Actually, we should appreciate and thank you for joining us. Dr. Ali Latif is a senior consultant physician, and he is director of the National Diabetes Center at Indira Gandhi Memorial Hospital in Malé, in Maldives. He is the chairman of the Technical Advisory Group at the National Emergency Operations Center in Maldives for managing COVID-19. He is also a member of the National High Level Committee on Controlling Non-Communicable Disease and also the National Health Research Council. And he's the president of the Maldives Society of Internal Medicine. Dr. Ali, so many people have logged in today from across India, from across South Asia. Dr. R.S. Chaudhary is a senior surgeon from Haryana in northern India. Prakash Vadvani Sahab is there. वो आपका हार्दिक अभिनंदन करते हैं. A warm welcome from his side. Dr. Rameshpal Singh Pawar is a senior pediatrician. He welcomes you. And so does Awadh Kishore Rathore Sahab, Seema Bindru Madam. Seema ji is from Kolkata. Karna Pramod ji, Arna Tyagi ji, Vinod Kumar Bhakta. So many people saying hi to you. Also, Arshia Ahmed is with us. And one of our senior doctors from New Delhi, Shubhlata Chitwal Madam, has joined us. Kedar Joshi ji welcomes you in Hindi and in Sanskrit as well. Suswagatam. Warm welcome. So, sir, some of us in India have been to the Maldives, but very few of us. But all of us know about the Maldives. We think of the Maldives as a very sunny paradise where there can be no illness, no disease, no virus, no COVID. What are the Maldives like?
Well, I would say this is a paradise. It's very true to say like that because it's quite different from India. I studied in India, and if you compare Maldives and India, it's so different. It's a very small island nation, but problems are similar actually. A small island nation with most of the islands about 1 square kilometer, less than 1 square kilometers, and about nearly 200 islands. But most of the islands are uninhabited islands. Mali is a very small city, but we have everything here. We have football grounds, we play cricket also. We have cinemas, but very small, just about 2 square kilometer island. And we have a hospital, large hospital also, tertiary hospital. I mean, compared to the size of Mali, I mean, it's quite different. And we are most popular for the number of top class resorts, and most of the visitors visit Maldives to the resorts.
Yeah. When we look at the health indicators, डॉक्टर साहब मालदीव्स के बारे में बात कर रहे हैं. मालदीव्स वाकई एक जन्नत है, एक पैराडाइज है. बट वहाँ पे लोग रहते हैं ना. इट्स ह्यूमन बीइंग्स हु लिव देयर. एंड जैसे साउथ एशिया में बाकी जगह चैलेंजेस हैं, मालदीव्स में भी चैलेंजेस हैं. बट व्हाट आर द हेल्थ केयर इंडिकेटर्स लाइक इन मालदीव्स? बिकॉज व्हेन वी रीड द डेटा, so what impression do we get about maternal health, child health, social health in the
I
Maldives?
think in this region we will be rated among the top. Actually, we have successfully controlled communicable diseases, but unfortunately, with this, the number of non-communicable diseases have increased a lot. Actually, so diabetes, heart diseases, chronic kidney diseases, hypertension is extremely common actually here. So extremely common, but except for a few diseases like dengue fever and chikungunya and scab typhus, we don't see many infectious diseases. And diarrheal diseases are extremely uncommon in the Maldives.
तो ये बहुत अच्छी चीज़ है मालदीव्स की कि जो कम्युनिकेबल डिजीज़ेज़ हैं, जो इन्फेक्शन से होती हैं, वो तकरीबन एक लुप्त जात की तरह हैं. दे आर ऑलमोस्ट एक्सटिंक्ट देयर. डायरिया नहीं होता, दस्त नहीं लगते. डेंगू, चिकनगुनिया कभी-कभी होता है, पर बहुत ही डेंगू इज़ आल्सो आई थिंक इरेडिकेटेड, इट डज़न्ट एक्सिस्ट.
No, actually, dengue is quite common, and we have episodes of dengue outbreaks in the Maldives, and so far we have not been successful in controlling dengue. But compared to before, even the number of dengue cases also have dramatically come down. But I also would highlight that our management is also quite good, quite successful, and we are now able to manage dengue cases effectively, not only in Mali but also in the islands. We have a lot of training programs directed at the medical officers and health workers in the islands. So even they can manage the dengue cases very well, I would say. And many of the experts who visit Maldives, they were quite impressed with the way dengue is managed in the Maldives because it is endemic here, and then almost everyone has seen and have managed dengue cases.
तो जो कम्युनिकेबल डिजीज़ेज़ हैं, वो तो ऑलमोस्ट लुप्त हैं, मगर अगर हैं भी, जैसे कभी-कभार डेंगू बुखार हो गया, तो वो छोटे टापुओं में, इन द स्मॉल आइलैंड्स, छोटे एटॉल्स में भी कंट्रोल हो जाता है. सो द मैनेजमेंट इज़ क्वाइट गुड. सो जो आंकड़े हैं सेहत के, उनमें मालदीव्स टॉप पे आता है. सो ऑल दैट इज नाइस, बट सडनली इन दिस पैराडाइज, इस जन्नत में कोविड आ गया. सो सर, व्हाट हैपेंड अबाउट 2 years ago? All the other countries kept on reporting COVID. Was Maldives affected right at the beginning, or were you able to sort of remain standing until some time?
It was not very like that, but initially when we started getting the news, we started preparing because we knew that our whole survival depends on tourism, and with this global pandemic, then definitely Maldives is going to get affected, and we knew that sooner or later COVID is going to come because there are a lot of tourists visiting Maldives, and we were preparing. We are preparing not only for managing in Mali but also managing the cases in islands as well as in resorts. So it was a special terrain because, as you know, most of the things are densely populated. Most of the services are also mostly in Mali. And if COVID spreads into the islands, it would be very difficult. And also with the tourist resorts, it would be very difficult. So we started in the initial stage also, we started developing SOPs and we started disseminating information to all the resorts and all the islands. And we did really prepare in advance. And we also knew that if COVID comes to Mali, and because this is very small island, very small place, it's going to spread very, very fast. And for that reason, we took precautions very early on. For example, even before the mask was made, was recommended or made compulsory, we start talking about the mask, and it was quite acceptable for the public to wear the mask. And we start also much earlier. We recommended people to wear the mask at least indoors. But we did not ask them to wear a mask outside because we were scared that if we actually do like that, the public may demand for the mask and then we will not be able to supply it. We developed a lot of SOPs and then we disseminated it. And that was, I think, one thing we did correct in the beginning itself.
So let us take these things one by one. देखो डॉक्टर साहब बात क्या कर रहे हैं हमसे, and many other people have logged in now, Dr. Ali. डॉक्टर भालचंद्र मेश्राम, बिमला कपूर जी, अनामिका नू, राजेश मेहता सब आपको नमस्कार कर रहे हैं. नमस्ते from everybody. And a salam to
Namaste.
you from Afghanistan, from Dr. Noor Aga Danish.
Walaikum salam.
अब देखें डॉक्टर साहब ने बात क्या की. पहले तो बात ये की कि हम इस पृथ्वी का हिस्सा हैं. वी आर अ पार्ट ऑफ दिस वर्ल्ड. हम अलग नहीं हैं. You cannot imagine that, or you cannot think that there will be a lot of dengue or a lot of COVID or a lot of malaria in the neighboring country and it is not going to affect you. It doesn't happen like that. The virus does not respect national borders. तो एक तो ये चीज कि हमें पता है कि दिक्कत आएगी. दूसरा, हमने तैयारी की. We began preparing in a timely manner. हमने शुरू में ही तैयारी शुरू कर दी. दिस इज व्हाट सर इज टीचिंग अस. अब क्या तैयारी की? व्हाट डिड ही प्रिपेयर? नंबर वन, एसओपी, स्टैंडर्ड ऑपरेटिंग प्रोसीजर्स. You plan, you create a procedure, you put it in print, in writing. Number two, disseminate the information. SOP लिखना ही काफी नहीं है. As maybe now, let us say Seema ji is the head of her family. It is not enough just to write an SOP that this is what the children must do in the morning, in the evening, and night. You have to disseminate the information. Where will you disseminate the information? देखो डॉक्टर साहब क्या कह रहे हैं, not only in Male but also in the islands, in the resorts, तो दूर दूर तक. So if you have an SOP in place, you should not disseminate it only to your family but also maybe to your colleagues at work, to your friends, to people who come to work in your house, to your household staff. Everybody has to get that information. फिर इन्होंने क्या बात की कि मास्क बाद में मैंडेटरी हुई. द मास्क वाज मेड मैंडेटरी लेटर बट वी बिगैन टॉकिंग टू पीपल अबाउट इट. हमने बात करनी शुरू की. सो व्हेन यू बिगिन स्पीकिंग टू पीपल अबाउट अ पर्टिकुलर एस्पेक्ट, लेट अस से अबाउट वैक्सीनेशन, कि हमें टीकाकरण करवाना है अगले महीने, वी हैव टू गेट वैक्सीनेटेड नेक्स्ट मंथ, अभी से ही बात करनी शुरू कर दें, राइट? सो देन that's what they did initially. So let's take these things one by one. Dr. Ali, these SOPs or the standard operating procedures that you made, let us say in March 2020, were they the same in 2021 and 2022, or have you had to change them in between? Have you had to improve?
We, we had to change because initially we also did not know about this and nobody knew about it and things were changing. It was dynamic and also we have to make these SOPs and protocols relevant to the Maldives. And we cannot directly take something that is written by some other expert, even though that may be very much relevant for their country. It might not be suitable for Maldives. And we had to change many times. And there were some accusations also that we keep on changing it. And you know that sometimes people got upset and told that you really don't know what you are talking about. On TV yesterday, you said not to wear the mask in public, and now you are saying that you wear the mask in public. So comments like that also came, but we kept on telling them that this is a dynamic process, and as evidences are available, and we will be modifying as per evidence, and we'll be discussing with you and the reason behind why these changes are made. And I think I would say that many times when faced with challenges of implementing these new SOPs, and we tell them that it is all evidence based, and we were always able to convince the policymakers and others that this is an evidence based one that is done by experts throughout the world, and what we are doing is modifying it so that it is acceptable to the Maldivian people. We did change a lot actually.
So, two things coming out of this, and both equally important. First of all, if there is an SOP, standard operating procedure, it can be changed because साइंस बदलती रहती है, साइंस चेंज होती है, नई नई रिसर्च आती है. तो आज आपको कुछ चीज ठीक लग रही है, पर कल आपको दूसरी रिसर्च मिल गई, नई चीजें पता चली, या कोविड-19 ने अपने आप को बदल दिया. लाइक द वेरिएंट चेंजेस, इट हैज चेंज्ड फ्रॉम अल्फा ऑल द वे अप टिल ओमाइक्रॉन, and of course delta is something that we don't want to remember now. But because science evolves and changes and improves for the better, our response also changes, the standard operating procedure also changes. तो एक तो ये चीज हमें सर से पता चली, वेरी इंपॉर्टेंट. दूसरा ये कि जब भी आप कोई चीज चेंज करते हैं, whenever you change, there is always there is going to be some amount of distrust, some amount of discomfort, and some amount of let's just take it as discussion. So don't take it as hatred, don't take it as a criticism, just take it as a healthy discussion. तो अगर कोई चीज चेंज हुई है तो उसका कोई कारण होगा. So Dr. Latif told the other stakeholders that this is the reason. See, this is the new evidence that has come. That is why we have changed our SOPs. And फिर वो चीज लागू भी हो जाती है. Then it gets approved. So now we are learning, and Maldives is actually being taken in the entire world. Maldives is being looked at as a success story for COVID-19. They have been able to live successfully with COVID-19. So COVID-19 है Maldives में. Dr. Ali never told us that they have eradicated COVID-19. They have
Yeah.
eradicated so many other diseases, but not COVID-19. But they are able to live with it, and they are able to live successfully. All the commercial activities are going on, all the social activities are going on, but in a healthy manner. तो यही हम सीखने की कोशिश कर रहे हैं. This is what we are trying to learn from the Maldives. How can we incorporate their learnings into our lives so that we can make our lives healthier and more optimal? Let's talk about the mask, Dr. Ali. And Seema ji from Kolkata says that the mask is that door which we need to keep shut. We have to keep this door shut from the unwanted virus because we don't want the virus to enter our house. So the door is the mask, and we must wear it when we are in public. She says, hats off to the Maldivian people. Three cheers for
Thank
you.
you.
And she asks initially, how difficult was it to motivate people to wear masks in public? And how is the
Because
situation now?
at the time, because Maldives people used to watch a lot of TV, and the internet is freely available, not freely available, but everybody uses. Everybody has a mobile, and they keep on watching what is happening around the world. And when we start talking about it and start explaining, and then we started lots of media programs, and then that it would come to us, and we need to be prepared. And because we have limited medical facilities, and that unless we are prepared, we would have the same, we'd face the same things that happen in other countries. And because of that, actually, people were very receptive to masks, very receptive. And many people actually wanted also for us to make it mandatory also. But like I said before, and because we have to depend on other countries for even mask also, we have to import it, and we couldn't. But acceptance was remarkable actually. And also we did enforce also. We did enforce also. We asked the police to enforce also, and that was also a challenging task because at such times people also don't want all sectors. They don't want really to be seen as people who go and punish. But at the same time, we need to just having a policy or recommendation is not enough, and it must be implemented. And we started implementing also on the roads. Also, if people don't wear masks, and we gently tell them, please wear the mask. And it was well taken by the public actually. And the public really supported all the interventions that we made. And of course, as time goes by, this intervention becomes really hardship in terms of economic activity, and then sometimes people may object. But overall, our success also is largely because of an excellent contribution by the public. They really did their part.
That is really nice. And apart from Seemaji, Madam Shubhlata Chetwal also saying commendable achievement of the Maldivians. And hats
Thank
off to
you.
the public then. Of course, the Maldivian public is lucky that they have doctors like Dr. Ali Latif and his team to help in stewardship. But the points that are coming are, डॉक्टर अली कह रहे हैं नंबर वन, जो पब्लिक था उन्होंने मास्क को एक्सेप्ट किया, ज्यादा दिक्कत नहीं आई. दूसरा, पुलिस ने भी कहा कि आप मास्क पहने. So, Dr. Ali, did the police request or did they tell or did they order? What was the commonest style?
Most of the time, it is actually uncommon those days for people to come out without wearing the mask. Uh, they actually tell, they politely tell. In general, we were reluctant to do fine, to put fine, things like that. And mostly it is a gentle reminder, and they tell them, please wear the mask.
So I think a good suggestion for our Indian policemen and women also. A gentle reminder will work more than maybe a rude demand. So another
I
good thing
think
that
so.
we have learned from the Maldivian police, how to police a nation. Dr. Tejas Gode also saying good job to the Maldivians for having done so well. And Seemaji shares a good practice. She has shared a link in the chat box for everybody. She has devised a way how to breathe easily with double mask. Sometimes it can be suffocating in the mask, but if you use camphor and eucalyptus oil, then life becomes much easier for you. Savita Bhutani ji is also logged with us. Good evening, madam. And Dr. Dr. Noor Aga is from Afghanistan, Dr. Ali. He says, which type of mask is used for going in public? What do you recommend? Like N95, surgical cloth, what do you recommend?
At the time, we had surgical mask, and we asked them to wear surgical mask. It was available, and N95 mask, we wanted to make sure that it is available to the healthcare professionals, because our healthcare workforce is very small, and then we were scared that if suppose they get ill, there would be a lot of problems, and we categorically told that N95 mask should not be used actually, because even if it gives you more protection, we have to take into broader context. And then if the mask, people buy the mask, and then if it is not available, that would be a big problem. Also, we make sure that even healthcare workers, when they go out, they don't wear this N95 mask. So we suggested that it should be only surgical mask because it was available, and then later when evidence start coming, we also said that it is fine to wear cloth masks also. It is fine. It's
So cloth mask is okay for going in public, and cloth masks are also a different type. Dr. Ali, if somebody is wearing a hijab already and is covering the lower part of her face, then she doesn't need an extra mask, or does she still need?
No, she doesn't need actually. And also, I think it became quite popular also, and they have different design masks and things like that, and it also become part of the dress also. And now we often see the cloth mask with various designs, and they are wearing it actually even now. We started with Omicron, so we started asking again people to wear the mask. But of course, now the response is a bit different from those days in a year back.
Yeah. Dr. Tejas Gude supports what you have just said, Dr. Ali, and he also says that for the public, in public spaces, surgical mask and cloth mask is enough. We don't need N95. And you can actually just make it part of your routine attire. You can have a mask which is, matching with your suit or with your salwar kameez, or with your shirt and trousers, and then that will look nice also. In India, also, many of these are available. Another aspect is about hygiene. So, what does our religion tell us about hygiene? In the Hadiths, hygiene gets top respect. So, even in the Bible, it is said that cleanliness is next to godness. So, would you like to talk about some Hadiths, Dr. Ali, which can be used in our population to help people just focus on hygiene, and then all hygiene automatically becomes a God-given duty and responsibility?
Islam stressed a lot on the cleanliness, and in fact, the way of life for the Muslim, the 5 times prayer, it actually mandates a person to be clean actually. So that is a part of life actually. And if you are unclean, you are not supposed to pray, and you are not supposed to enter a mosque.
Yes.
So that's a way of life, and it is very much followed in the Maldives. And in general, Maldives, the cleanliness is actually quite high, quite a, perhaps because it is access to water and access to these things means that they can do it. So, though I am unable to actually tell a hadith, but Islam stress a lot on cleanliness.
सो हाइजीन या सफाई जो है वो एक जिंदगी का हिस्सा है, अलग से नहीं है. इट इट इज जस्ट अ पार्ट ऑफ लाइफ. और अगर हम उसको ऐसा देखें कि ये जिंदगी का हिस्सा है, इट्स अ पार्ट ऑफ लाइफ, तो तो ऑटोमेटिकली हाइजीन हमारा हक भी बनता है. हक मीन्स राइट, और हमारी जिम्मेवारी भी बनती है, विच मीन्स रिस्पॉन्सिबिलिटी. सो हाइजीन बिकम्स अ राइट एज वेल एज अ रिस्पॉन्सिबिलिटी फॉर अस. अगर हमने लफ्ज़ इस्तेमाल कर लिया, हमने शब्द इस्तेमाल कर लिया, इफ यू हैव यूज्ड द वर्ड हाइजीन या सफाई और क्लीनलीनेस, तो अब हाइजीन की डेफिनिशन क्या है, परिभाषा क्या है? हाइजीन मीन्स टेकिंग केयर ऑफ एवरी पार्ट ऑफ योर बॉडी, and that includes wearing a mask, following personal hygiene, following social hygiene. And if you're able to explain this to the community around you, and you can use religious scriptures which people respect, then automatically you will see that the uptake will increase. And I think because of the ingrained importance of cleanliness in Maldivian society. That is why also perhaps we were able to contain COVID much easily there. Do you think that would be true, Dr.
I,
Ali?
I think so. And people really followed it very much. And in fact, people after going for shopping and returning home, and they would clean all the stuffs. They
Yeah.
followed exactly what we asked them to do. And that is one of the reasons why we were successful. The
So
public really followed.
followed. So अब देखो इसमें तीन चीजें आ रही हैं, three things coming up. डॉक्टर साहब ने कहा, एक तो पब्लिक ने फॉलो किया. The public has actually inculcated hygiene into daily life. दूसरा जो हमने कहा, what we said, so there were leaders from the healthcare team like Dr. Latif and his team who actually uh, told the right things. They were in touch with the latest developments across the world, and they told the public. So you need leaders to tell, to share. You need the public to listen and to actually follow what is being done. बट एक और तीसरी चीज है, द थर्ड थिंग इज, किस तरीके से कहा गया, किस तरीके से सुना गया. इन व्हाट वे डिड यू शेयर द इंफॉर्मेशन, in what way did they perceive the information? So Dr. Ali, what kind of a style works in the Maldives? Ordering, dictatorial, democratic, requesting? You'll have to unmute, sir.
I think so. The best word to use would be firm, and not as very soft and not really very aggressive also. But we need to be firm, and we had developed. We had a team of doctors and public health experts and nurses, and a big team was there, and we come on TV almost daily, and then we we tell them that this is what is going to happen if you don't do it, and this is what is going to happen if you do it, and these are the evidences for it, and you must follow like this. And we explained all the reasoning behind each of the interventions that we made. We knew that it would make life very difficult for the public. Even then, we explained the consequences it will have if you don't follow it. And we tell it very firmly. And we also told them that if you don't do it, this is what is going to happen. For example, if outbreak of COVID occurs in a major way in Mali, we don't have facilities to admit them. And if we don't have facilities to admit them, we are definite that a lot of people are going to die. And if we want to actually avoid deaths like that, we need to work hard. And we are very sure, we are confident that if we do these things with evidence-based things, that we'll be able to survive this COVID.
Yeah.
And that's what happened also. And we
So see
actually
that.
did tell them that in the background that we
Carry
are
on, sir.
preparing for the things that are not available in Mali. And for example, they also told them that we are going to build new places, like new hospital and other healthcare facilities in case there is a big surge. And to avoid this one, we must do like this. I think we have to tell this very firmly, and not aggressively and not very softly also. And we need to put facts before them. And one advantage was this time the whole uh, the COVID response was led by a medical team, and government was very committed to do like that. And because of political commitment in dealing with this in an evidence-based manner by medical expert, is I think one of the key reasons why we also were successful.
So many take homes, Dr. Ali, which I am learning from you now, which all of us are learning. एक एक करके लेते हैं इनको. सबसे पहले फर्म होना, ज्यादा ढीला भी नहीं होना, डोंट बी सॉफ्ट, ज्यादा सख्त भी नहीं होना, डोंट बी टू रिजिड और टू रूड, बट बी फर्म. ये तो एक चीज है. दूसरा ये है कि अकेला यही नहीं बताना कि क्या करना है और कैसे करना है. इट इज नॉट इनफ टू टेल व्हाट टू डू एंड हाउ टू डू. आपको ये भी बताना है क्यों करना है, why it has to be done. So what to do, wear a mask, how to wear a mask, and why to wear a mask. एंड डॉक्टर अली ने दोनों पहलू बताए इसके. वाई टू वेयर अ मास्क, यदि आप मास्क पहनेंगे तो महामारी नहीं बढ़ेगी. इफ यू वेयर द मास्क, देयर विल बी नो एपिडेमिक. इफ यू डोंट वेयर द मास्क, यदि आपने मास्क नहीं पहनी तो बहुत सारी महामारी फैलेगी, हम आपको दाखिल नहीं कर पाएंगे, फिर गड़बड़ का चांस है. सो सी, क्यों का जो जवाब है डॉक्टर साहब ने दो तरीके से दिया. नंबर वन, व्हाट विल हैपन इफ यू डोंट वेयर द मास्क. Number two, what will happen if you actually wear the mask? Both of them, he told. साथ में गवर्नमेंट ने ये भी बताया कि while all this is going on, we are working, we are fulfilling our duty. We are making camps and we are making hospitals for COVID-19. We are fulfilling our part of the responsibility. In the meantime, please fulfill your end of the bargain and wear your masks. So I think these are simple things which are missing in our public health communication in India. Sometimes we focus a lot on uh, what to do and how to do, like what kind of a mask to wear. There will be a lot of discussion on N95 versus surgical. How to wear the mask, how to remove it. There will be a lot of discussion on that. That is required. But sometimes I think we forget to talk about the why. Apart from the how and what, we forget to talk about the why. And the government is working hard here as well, preparing for the fourth wave. And the government actually tries hard. If you see, it is such a big country. But maybe in public health communication, sometimes we lack. There is a comment from Languji, and she recently visited Shanti Niketan, which is in West Bengal. This is where Rabindranath Tagore lived. And life is so normal there. It is a rural area. There are people wearing masks in the market, but in the village area, people are so innocent and pure, and the air is fresh, the soil is fresh. So if we actually remain connected to nature, then and if we maintain hygiene, then no virus can touch us. I think yes, the virus did come in because of poor hygiene. That is how it started in China, because of poor hygiene. So you have a point, madam. Surinder Kumar Bansalji adds to what you say, Dr. Ali, and he says he wants your comments on this. Three powerful tools against COVID. One is masking, second is vaccination, and third is social distancing. So, Dr. Ali, let's take social distancing first. Uh, Malay is so densely populated. How do you manage social
This,
distancing?
this was one of the biggest challenges actually. Social distancing became the biggest challenge. It was very difficult, but they did to some extent. Initial stage when we in the initial part of 2020. At the time, we did put a lockdown very early on, because we did that to prepare. So at that time, everybody was at home, and by the time they came out, people knew that social distancing is a key component of COVID control. They knew about it, and masking, of course, we started doing it much earlier, and these two components. Vaccination came a bit later. So people knew about social distancing, but it was difficult because people in Maldives, they are always together actually. Friends always meet outside, they always have coffee, and this coffee culture is very much popular in the Maldives. So they want to go and sit for a coffee with their friends and then move around. And the community is different. So that is a big task. And it's really a big task and difficult one also.
But if you are with friends and you are wearing mask, then that is okay. So mostly people are masked now when they are in the
Now
coffee
it is
shops.
less. And now it is less. We started giving messages that they have to wear the mask again. Coffee shops actually, they of course while having coffee they have to take it, but this culture is so much here in the Malay, and it becomes very difficult. And also, it's very small place, and it's impossible. And people meet even in the night. So I have visited Maldives, and even in the night around 10, 11 o'clock, so people are out on the street and for meeting friends. So it's not like, for example, this family has this number of friends, but that circle is quite big. So it becomes a challenging job actually in Malay to have social distancing.
But still, you must have done a great job. And Dr. Noor Aga has shared a hadith with us. And thank you, Dr. Aga, for doing that. Cleanliness is half Iman. Iman means belief in Allah, which means that cleanliness, if you follow cleanliness, it means you have done half the job of religion. So thank you for that, Dr. Noor, and I'm sure Dr. Ali will use this hadith now many times when
Yes.
when talking on TV in Maldives. There is another hadith जिसमें पैगंबर कहते हैं, the prophet says कि मैंने हर चीज की दवा भेजी है दुनिया में, सिर्फ बुढ़ापे की नहीं भेजी. I have sent a cure for every disease on earth except old age. तो बुढ़ापा अभी तो आया नहीं है हमारा, ना डॉक्टर लतीफ का, ना मेरा, ना डॉक्टर नूर का, ना किसी का जो इस टॉक शो में है। सो ओल्ड एज हैजंट कम टू अस येट। तो वो जब आएगा तो तब देखेंगे, दैट टाइम वी विल सी व्हाट इज टू बी डन, बट बाकी हर चीज की दवा है। फिलहाल जो कोविड-19 एक मर्ज है, भगवान ने भेजा, गॉड सेंट इट, बट कोविड-19 का इलाज भी तो भगवान ने भेजा ना। सो दैट इज द सेम थिंग which just now Surinder Bansal ji pointed out, masking, vaccination and social distancing. तो ये दवा अगर हम लें, ये खुदा की देन है, भगवान की देन है, इट इज सेंट बाय गॉड, द वैक्सीन इज आल्सो सेंट बाय गॉड एंड वी शुड एक्सेप्ट इट।
Indeed.
करना प्रमोद जी कहती हैं, हाउ डू वी यूज क्लॉथ मास्क, डू यू हैव एसओपीज इन मालदीव्स फॉर दैट, हाउ फ्रीक्वेंटली यू हैव टू वॉश देम, कैन यू यूज देम और यू हैव टू थ्रो देम एवरी डे, change them every
No,
day,
they
any
actually
SOP?
they wash it. They wash it, and we had given this SOP on cloth mask also, and it is shared with the public also. And now many people use the mask is now freely available, surgical mask. Many people wear surgical masks also, but often for the ladies it is now a part of the dress and a stylish one, and they very frequently use cloth mask and washable ones. But then of course they
Well,
may people use in different ways.
yes. The another comment from the audience is that how I wish all of us in India have been had been so disciplined as our friends in the Maldives. Things would have been better here as well. There is a question about discussion in the Maldives. How heatedly was vaccination discussed? Was there
That's
vaccination hesitancy, skepticism,
Yes,
fear?
very much it was. Because we have for childhood immunization program is actually very strong in the Maldives. So everybody gets immunization, they get vaccinated. But adult program is not as strong as that. And with the vaccination, we start having a campaign that this is one of the key components of COVID control. And then we made sure that we met a lot of people in TV programs. We also had online discussion with at all the task forces. We also had met with schools, principals, and then parents, and a lot of effort was put on this vaccination because people were scared, and there were a lot of misinformation going around that this is a vaccine is only for a testing purpose and it is for an economic reason, and they will have a lot of negative consequences. And we worked very hard on this component of it, and they also want to have the best vaccine available, and different people have different opinion regarding which is the best vaccine. And some people wanted, okay, I want, for example, Pfizer vaccine, and somebody want Moderna. So I kept on telling, but we also kept on telling it is very important that we get whatever vaccine that is available, and it has shown to be uh, is effective against COVID, and we need to use it. And because of this extensive program, and people started taking vaccine, and our vaccination coverage is now at over 80% actually, over 80%. So we did
80% is
quite
excellent.
well, I think. And also, people are very scared there would be side effects, and we had special teams. And then, if they have some issues, so they can directly contact a doctor's team. So we also made a doctor's team, and we can respond to them in the initial 1 to 2 months when vaccine was launched. After that, we trained a lot of health workers, and then we have focal points. And if they have any issues, we will deal with it. And our AEFI program is also actually, I would say, it was very good, very dedicated team of doctors actually uh, evaluated every case that is reported, and we encourage everybody to report any kind of side effects following vaccination, and that also give confidence that that we would be looking after them if something happens. Even people who got who are in bedbound at home, we interviewed them, and then we made sure that these are really good candidates for vaccination, and we sent teams there and to give vaccine. And also, even the vaccination centers, we make sure that there are people who are able to manage, if supposing, even health workers, and many of them are now well trained for dealing with any kind of adverse event following vaccination. Anaphylaxis also, they will be able to manage on their own. And even vaccination centers, we make sure that there's a doctor, there's a nurse, and there is a this association facility available for if there is any adverse event. And people got, I mean, they had confidence in the program is actually good, and that's the reason why. But of course, now there are elements in Maldives also in which they don't want to vaccinate, and this is not only because of COVID, not only for COVID, but for other vaccines also, and it is there. But overall, I think the program was quite good, very good, and
सक्सेसफुल।
it also contributed.
तो सीमा जी ने पॉइंट भी बहुत रेज किया और जवाब भी बहुत अच्छा आया। द पॉइंट दैट इज रेज्ड इज वैलिड एंड द आंसर इज इवन मोर वैलिड। कोई डिस्कशन हुई या नहीं हुई वैक्सीनेशन पे, तो डॉक्टर साहब कहते हैं बहुत डिस्कशन हुई। तो अब डिस्कशन का जवाब क्या है? डिस्कशन, कम्युनिकेशन गैप का मुझे एक ही इलाज आता है इस पूरी दुनिया में। आई नो ओनली वन सॉल्यूशन टू कम्युनिकेशन गैप, एंड द सॉल्यूशन इज कम्युनिकेशन। अगर कोई कम्युनिकेशन गैप है हम में आपस में, तो हम उस गैप को कैसे सुलझाएंगे? आपस में बात करके ही सुलझाएंगे ना, गुफ्तगू से, वार्तालाप से। तो यही चीज हमारे मालदीवियन दोस्तों ने की। दे रीच्ड आउट, दे रीच्ड आउट टू अदर डॉक्टर्स, टू हेल्थ केयर प्रोफेशनल्स। दे वेंट ऑन टीवी, दे वेंट ऑन ऑनलाइन चैट्स। इन्होंने स्कूल टीचर से, प्रिंसिपल से बात की, पेरेंट्स से बात की, इन्होंने मौलवियों से बात की होगी। दे वुड हैव स्पोकन टू रिलीजियस लीडर्स एज वेल, आई एम श्योर।
Yes,
सोसाइटी लीडर्स, जो जो कुनबे के जो चीफ हैं, उनसे बात की होगी और उनको समझाया कि हम ये आपके हित में कर रहे हैं। एक तो अकेले बातचीत नहीं की। इट इज नॉट दैट दे ओनली स्पोक और दे टॉक्ड। अकेले ज्ञान योग नहीं किया इन्होंने, इन्होंने कर्म योग भी किया। इट्स नॉट ओनली नॉलेज, दे ऑल्सो वेंट इनटू एक्शन मोड। So they actually had teams which were knowledgeable, and AEFI डॉक्टर साहब ने लफ्ज इस्तेमाल किया, डॉक्टर साहब ने किया। AEFI है एडवर्स इवेंट फॉलोइंग वैक्सीनेशन। यदि किसी ने कोई कंप्लेंट की, supposing somebody complained of a cough or a fever after the vaccine, immediately a team reached that person. Is that right?
they can call us and we will respond. And
Yes.
if it
हाँ,
is, yeah,
हाँ, तो दो तरफा था। वो भी हमसे बात कर सकते थे, हम भी उनसे बात कर सकते थे। इट वॉज टू वे।
just
So
do
you
it.
can, so there is no scope for communication gap, and that instilled confidence in the society कि वाकई ये सेफ वैक्सीन है और लोग मेरा ख्याल रख रहे हैं। I've seen the same thing happening in my district. Uh, we have seen our healthcare teams working so hard actually to trace people who have come from New Delhi airport, to follow up people in home quarantine. So here also the healthcare teams have been working really hard and without any extra rewards. So actually, I would like to salute here all the healthcare workers of Maldives and all the healthcare workers of India. Without whom we would not have been able to come out of this. लास्ट 2 इयर्स चैलेंज भी बहुत रहा है। इट हैज बिन अ मेजर चैलेंज, बट फाइनली एक ट्रायम्फ है साइंस की, साइंसदानों की। बट ये साइंस का जो ट्रायम्फ है, ये हमारे हेल्थ वर्कर्स के बगैर नहीं होना था। सो डॉक्टर अली, इफ वी वर टू, ऑफ कोर्स एवरीबडी हैज प्लेड अ रोल, द गवर्नमेंट ऑफ मालदीव्स, the public of Maldives, the doctors, the health workers, your nurses. So, whose role do you feel would be most important, or is it difficult to answer that question?
It's difficult to answer the question because uh, being doctors, we are always in the hospital, and I was also most of the time in the hospital. This time when we came out, the the approach was quite different, and every agency they committed 100%. Maldivian Police Service, MNDF, Maldivian National Defense Force, and various NGOs, and so many people, and the effort was put in those few months was remarkable actually. And many people who really doesn't have any experience and very young, and they were on the roads taking samples as RRT teams, and it was remarkable. And so it would be sometimes doctors also may think that they are the only people who really work very hard, doctors and nurses. Of course, our role is very different because we are in the hospital looking after, and they did an excellent job. But there are so many other people also who did equally good job, and it was something we saw daily in that center, yeah, in COVID center, from very young people to very old people, worked very hard. So I would say it would be
So,
extremely difficult question to answer. Who
so
would be
now we know why, Dr. Ali is a leader in his country, क्योंकि इससे ज्यादा हम्बल लीडर आपको कोई नहीं मिल सकता। डॉक्टर साहब क्या कह रहे हैं? डॉक्टर्स नर्सेस को लगता है कि सिर्फ वही काम करते हैं। ये वाकई सच है। कई बार हमें लगता है कि सिर्फ हम ही काम करते हैं दुनिया में। दैट इज ट्रू, मगर ऐसा नहीं है। मालदीव्स की पुलिस फोर्स ने बहुत मेहनत की। जो नेशनल डिफेंस फोर्स है, जो हमारा सीआरपीएफ, बीएसएफ, हमारा पैरामिलिट्री है, आर्मी है, उन्होंने बहुत काम किया। और जो हमारे सैनिटेशन वर्कर्स हैं, उन्होंने भी बहुत काम
yes,
किया। सो एवरीबडी वर्कड। और यंग लड़के, यंग लड़कियां, यंग बॉयज एंड गर्ल्स गोइंग आउट ऑन टू द स्ट्रीट्स फॉर पब्लिक अवेयरनेस कैंपेन्स, टू टेक सैंपल्स, टू हेल्प आउट। कोई एक्सपीरियंस नहीं था, पर वो देश के लिए निकले, they went out for their country and इकट्ठे
Mm.
मिलके काम हुआ. So Dr. Ali, this तो I will remember forever, this answer of yours कि पूरे मालदीव्स ने काम किया. डॉक्टर भालचंद्र पूछते हैं, was there any havoc in Maldives like we experienced in India? What was the worst situation for you?
Because we did have initially in the few in initial early January and February, we developed a plan for a possible lockdown, and we planned in how we will actually manage it. And when the lockdown came, even though we had a plans, we also did panic. And it was the first week was really terrible because there were many things that we did not really anticipate, uh, and it was a big challenge when we locked down the whole of the city. And then there are a lot of uh, foreigners working in the Maldives, and many people also. There are so many people living in these facilities and looking after them, and then looking after the non-COVID cases. And it was for first week, it was really difficult task. But somehow gradually with support of a lot of NGOs and Red Crescent and a lot of companies and a lot of volunteers, and many people joined together to manage it. So the first week was really hard, really hard, because we had
But
to deliver medicine to the houses also, and we had to deliver food to the houses also. And many people who, for example, expatriate workers and unskilled laborers who are dependent on restaurants for food, and suddenly their food supply is cut off because of we have closed all the restaurants, and then managing that. And we had a lot of volunteers and putting a lot of effort and also finances into it, and then feeding them. So it was difficult. Also, initially, we moved all the context also to dedicated quarantine facilities, and moving them from Mali to other places. In fact, we are probably the only country who did take the context to resorts. We had 25 resorts as quarantine facilities, and we had to move them. And moving them, we have to go by boat and sometimes by these seaplanes, and taking them. It was a very challenging one, but we did actually.
but
Because
you
at the
managed
time when
and
if some we did manage at the time when somebody becomes positive in the house, and everybody in the house also panics, and then we had to isolate them, and then more taking from different people from different houses, and then taking them in a launch or an aircraft to another island. So it was quite challenging. It was a remarkable job done by MRDF also in moving. They did the moving these patients and context to different facilities.
but finally all that hard work has paid off, which is very nice. Sir, Kedar Joshi ji पूछते हैं, what is the vaccine schedule in Maldives? Which vaccine is being used and what rules are you following?
We, the first one we got Covishield is the first vaccine we got Covishield, and only later, only for the booster dose only we are giving Pfizer. So only for the booster dose only. So we have one dose booster dose we had given actually, and then the discussions are going on. What we would be doing is
Hmm.
still discussion. I've got
Doctor,
a special team.
right.
There's a vaccination
And
team there. Will be looking into that.
so already that booster dose has been given. Dr.
Yeah.
Noor Aga asks, can I take a third precautionary dose of Covishield? I took two doses 6 months back.
This discussion is going on actually here, and then generally most people are willing actually to take the third dose. Also, they are willing actually, but it's the availability now in the Maldives. Availability is an issue actually, so we may not be able to. But Maldives, one thing is that they all follow the standard that is done by other countries, and they follow it. So it would not be difficult actually here.
Right. And maybe you can wait, and if possible, Dr. Noor, you can get your antibody titer tested if it is possible. Otherwise, we can wait for a few months for the precautionary dose. डॉक्टर शुभलता चटवाल जी बोलती हैं डॉक्टर अली के डोंट वरी बाय द टाइम you grow a couple of decades, we will have a good treatment for old age as well. So don't worry at all. And warm greeting to you, welcome to you to India from Dr. Hansraj Baveja. Dak Sahab is a senior consultant in our National Medical Commission Ethics Committee. So he leads our medical ethics team here in India, and he's a former president of the Delhi Medical Association. So Dr. Hansraj Baveja, Dak Sahab ko bhi namaskar and welcome. And welcome to you, Dr. Latif from Dr. Bhaveja. We have another person with us, Ashu Dhingraji. She's an educationist, and she asks, what role did the school teachers and the educationists of Maldives play in containing the COVID-19 pandemic?
School was one of the most challenging part actually. School, and because the type of emotions that comes with a kid getting COVID is very different from an elderly person getting it or a young person getting it. So we knew that school would be a very difficult task, and we made sure that the school is actively involved in all the processes. So in our this, HEOC, Health Emergency Operations Center, Education Ministry is also represented. And while taking decisions regarding school closures and different measures in the school, we also listen to them. And then, because there are many things that we don't know in the education sector, and things that we medical person very rigidly want to implement may not be possible, and there are so many things, and then we have to have some compromises actually. So education sector, the teachers and the principals actually did, and Ministry of Education, they did play a vital role. They did play a vital role. And they wanted us to have a balance in the child's education, their development versus actually exposing them to COVID. And it is one angle that they would be talking, and we talk of the other angle, and then we make a compromise and then ensure that the children are not exposed unnecessarily. So I think the key is here again a discussions and coming at a point where both parties agree on this one. And parents are also divided, and it is tough. But we did not
वो
have made outbreaks in the school. Actually, we did not have.
So I think the teachers would have played a really important role in teaching their children about
Yes,
social hygiene, about personal hygiene. And children usually listen to teachers. They don't listen to doctors. They don't like doctors. So it's basically teamwork. And see what Dr. Latif is saying. The key is communication, speaking to each other, and then finding the right path together. एक्चुअली इसमें ना हम इंस्पायर्ड हैं महात्मा गांधी से सो महात्मा गांधी यूज द वर्ड सत्याग्रह सत्या मीन्स ट्रूथ Satyagraha means searching for the truth. Suppose the doctor thinks that he knows the truth and only he knows the truth. Nobody else knows the truth. When he goes to a meeting, when he goes to a discussion with other stakeholders, he might come back unhappy. Same thing will hold true for the politician, for the policeman, for the policymaker, for the educationist. Nobody has a sole right over the truth. बट अगर आप ये मानते हैं कि मुझे थोड़ा सा सत्य पता है आई नो अ लिटिल बिट अबाउट द ट्रूथ बट द ट्रूथ इज मच वास्टर देन दिस नाउ लेट मी गो टू द डिस्कशन टेबल एंड लेट मी फाइंड द होल ट्रूथ द एंटायर ट्रूथ दैट ट्रूथ कैन कम फ्रॉम एनीबडी it might come from the sanitation worker who actually knows what is going on in the streets. It might come from the humblest of your household workers. If you are open to the truth and then you learn from each other, that is satyagrah. That is a search for the truth. And finally, you come back home happy, realizing that you have found the truth. This is exactly what happens to us, Dr. Latif, in every KK Med talk. We come into discussion. So many people logged in, thousands of people logged in from across the world, especially South Asia, and everybody has a different truth to share. But together we are able to strengthen each other, and it makes us go back home
exactly.
happier, wiser, and more fit actually to prepare for the next day's for life the next day. सीमा जी पूछती हैं, what about healthy food and good sunshine? Has that played a role in COVID-19 containment?
Actually, Mali, unfortunately, healthy food. Now people are going more towards healthy food, but in general, fast food is actually quite rampant here, and a lot of coffee and a lot of unhealthy foods, and that probably is the reason why our the NCD is so high, and with young people getting uh, CVDs, and it's very unfortunate. But at the same time, we are now seeing more people exercising and then going out. And people have two jobs, and it's very difficult for them to get really relaxed. It's a morning from the regular job from 8 o'clock to 4 o'clock, and then they have a part-time job. So getting sunshine also becomes a little bit difficult because they are inside always. And the walking is, and we need to change this one. We need to change, but it is going to take some time. And also here, as you know, everything is imported, and even vegetables and things are also pretty expensive. And if you want to get good vegetables, it's expensive also. So it is much more cheaper and more filling if you go and get some junk food. So
Maybe Seema ji will share next time when you come to our show. She will share best recipes for fish, so we can have a fusion of Bengali and Kashmiri and Maldivian fish recipes, and that would be something nice. That would be a good
That would be
addition to
so
healthy
nice.
food. डॉक्टर पवार पूछते हैं डॉक्टर पवार हैज अ वेरी सिंपल क्वेश्चन हाउ फ्रीक्वेंट वाज कोविड-19 इन चिल्ड्रन इन मालदीव्स
It is
इन
not
चिल्ड्रन
not very frequent. It is not very frequent because they stayed inside actually. They stay. The children don't come out, and that was one thing that people got really upset also because children didn't get to come out. So we kept on telling them to make sure the children don't get it. You make sure that people don't go out and bring COVID back to your home. And then if you want to meet your grandparents or your children, you make sure that you do your hand washing and you wear a mask and you come out. And it was not a major problem actually in children.
दैट्स गुड एंड हाउ frequent is Omicron variant now in Maldives? What is the latest statistics?
The thing is that we recently got the capacity to do gene sequencing, and most of the time we are sending abroad, and it is now detected in the Maldives, but so far we are unable to tell that it is really a major problem. But with the number of tourists coming now, and this is the season for the European side, and then so many tourists are visiting Maldives, and it is very likely that if it is there in other countries, it is going to come to Mali as well. And but we have not detected many cases actually.
A very important question. We've almost completed 1 hour. Dr. Baveja asks about tourism in Maldives, and he says, "Is it safe for me?" So, is it safe for me as a tourist to visit Maldives? So, let us just change this question slightly. If I want to travel, let us say to Goa or to Kerala or Andaman or Maldives, what basic precautions should I follow? So, maybe I'm flying from India into Maldives. How should I behave?
Because in the resort, no, each resort is one island. Each resort is one island, and the people in the resort, their vaccination coverage is actually very high. The vaccination coverage is very high. Some resorts touching about 90%. 90% coverage is there. And if you come, I suppose if you come that if you are vaccinated, and then you have done your PCR test and you come to Maldives, and then in the resorts, most of the people do not wear mask, and we do not force them to wear the mask also because that spoils their holidays. But overall, we don't allow people to go to resorts even if it is, for example, previously we made sure that to make it is safe for the tourists, we made sure that if a staff is going from an island where there is a significant community spread, they must go and get quarantine in the island for 14 days in the resorts. So if there's a community spread and a staff is going from an island to the resort, they must get the quarantine there for 14 days. And many resorts also have implemented PCR testing if staff comes to the island. Even the staffs who are in the islands, if they visit, they are, most of the time in early part of 2020, we did not allow staffs to go to their islands because they can pick and come back. So there are many interventions in place in the resorts to make the resorts a safer place. And I would say that Maldives is safe actually for you to come. But of course, we must not forget that we must get vaccinated, and then in coming here in the airport is a very small airport. Make sure that in the airport you wear the mask, because even if you go to island resort and if there are less people, it's one thing. But when you come, the airport is a crowded place, and make sure that you wear mask, and also make sure that you get vaccinated and come. You would encourage, even though there's no restriction for a tourist to get vaccinated for to come to Maldives.
तो एक बहुत स्ट्रॉन्ग टेक होम मैसेज अगर आप ट्रैवल करना चाहें ये सेफ है एंड मालदीव्स इज मोर देन हैप्पी टू वेलकम यू पर एक अपना टीकाकरण ज़रूर करवाएं और अगर आप एलिजिबल हैं प्रिकॉशनरी डोज के लिए थर्ड डोज के लिए जो शुरू हो जाएगी 10 जनवरी से फ्रॉम द 10th of January we will have precautionary dose for health line workers and for our citizens aged above 60 तो वो भी टीका ज़रूर लगवा लें and then if you follow the basic precautions like wearing a mask hand sanitation personal hygiene then it's a safe and enjoyable vacation that you will have in the Maldives. तभी तो मालदीव्स को वर्ल्ड लीडर माना जाता है पूरे वर्ल्ड में पूरे विश्व में कि एक्चुअली ये कोविड-19 को कंटेन भी कर पाए और साथ में अपनी इकोनॉमी भी चला पाए. So that is the strength of Maldives that we have been able to contain COVID-19 and also continue our economy. Both things have gone hand in hand. So we've been able to follow the middle path. Seemaji has also followed a very nice path, and she has this channel called Healthify My Cuisine by Seema on YouTube. And if you search on that, Dr. Ali, you might be pleasantly surprised to see healthy fish recipes which we can use.
I will.
So do try them out, take some tips. Seemaji is inviting you there, and let us know what you find the best. So it's been great having you, sir, with us today. 1 hour passed by and we didn't even realize. एक घंटा इतनी जल्दी से बीता पता ही नहीं चला. We just didn't realize where the time flew. And so many people watching you, so many people thanking you for your words of wisdom, words of insight, very simple words put forward in a very systematic manner. And I'm sure they will help us improve our communication with each other. But is there, before we leave, is there anything you would like to say to everybody who is watching today?
I think if we work together, we'll be able to manage it. And if in this link, even if even one person is weak, then the whole process becomes weak. And I think we should work together. And also, we should be supporting each other, not only within the country, but also between countries. And when expertise are required, it must be shared. And when resources are limited, it also must be shared. And unless everybody shares this one and control COVID, it is very likely that if Mali is having assault, then we will be taking it to the next country. If they have a site, they will be bringing it to Maldives. So that way, it is very important that we collaborate well together. Otherwise, we won't be able to manage it. And rich countries must help poor countries by providing what is necessary. And the smaller countries and less privileged countries can contribute by sharing the experience like what we are doing here. And I think that is the way forward.
तो बिल्कुल ट्रू लीडर की तरह कहा डॉक्टर साहब ने. एक तो इकट्ठे काम करें, वर्क एज अ टीम, कोलैबोरेट करें, आपस में बातचीत करते रहें. और डॉक्टर साहब ने एक और चीज कही, हम उतने ही ताकतवर हैं जितना हमसे सबसे कमजोर व्यक्ति. वी आर ओनली एज स्ट्रांग एज द वीकेस्ट इंडिविजुअल अमंगस्ट आवर सेल्स. तो सभी का ख्याल रखें. Thank you, sir, for those words of wisdom. And on behalf of the entire India and on behalf of KK Med Talks, I thank you for sharing your ideas, your opinions about COVID-19 and how Maldives was able to contain it. This is a
Thank you so much,
daily,
Sanjay sir.
thank you. This is a daily show that we have from 7 to 8 p.m. Indian time. आई होस्ट दिस शो एवरी मंडे एंड थर्सडे. मैं आपके साथ होता हूँ हर सोमवार और हर वीरवार. हमेशा हमारे पास एक अलग टॉपिक होता है हेल्थ से रिलेटेड, सेहत से जुड़ा हुआ. एवरी डे वी हैव अ डिफरेंट टॉपिक रिलेटेड टू हेल्थ. और हमारी कोशिश है, इट इज़ आवर एंडेवर, कि हम इकट्ठे, द वे यू हैव सेड दैट वी वर्क टुगेदर, हम इकट्ठे चलते रहें इस राह पे, इस जर्नी पे. और हम अपनी मंजिल तक पहुंचे. एंड द डेस्टिनेशन इज गुड हेल्थ फॉर हैप्पीनेस फॉर एवरीवन. मैं आपको फिर मिलूंगा वीरवार को, जुमेरात को. हमारे गेस्ट होंगे डॉक्टर शुचिन बजाज, और हम बात करेंगे, बड़ा इंटरेस्टिंग टॉपिक है, वर्क लाइफ बैलेंस. एंड आई ऑलरेडी सी करना प्रमोद जी एंड सीमा जी एंड शिवलता मैडम स्माइलिंग एंड लाफिंग. वर्क लाइफ बैलेंस एंड हेल्थ, हाउ डू वी अचीव वर्क लाइफ बैलेंस. एंड मैडम करना, मैडम सीमा, मैडम शुभलता, शुचिन तो हमारा फुल एक्स वाई मेल है, बहुत स्मार्ट और हैंडसम छोरा है हमारा दिल्ली का. बट वी शुड गेट अ लेडी डॉक्टर, आई थिंक, और लेडी पर्सन टू टॉक अबाउट वर्क लाइफ बैलेंस एंड वर्क लाइफ होम बैलेंस एज वेल. So we'll do that in the weeks to come. I realized that just suddenly while taking Shuchin's name. But thank you to everybody. आप सबका बहुत बहुत शुक्रिया लॉग इन करने के लिए. और फिर मिलते रहेंगे आपको. डॉक्टर लतीफ, थैंक यू सो मच.
Thank you so much.
थैंक यू. जय हिंद.